What I wish I knew when I was pregnant. Pregnancy is a time filled with excitement, anticipation, and sometimes a bit of anxiety. One of the most common concerns for expectant mothers is bleeding during pregnancy. It can be alarming, but it's important to understand that not all bleeding is a sign of trouble. Bleeding doesn't always mean something's wrong. In fact, many women experience some form of bleeding during their pregnancy, and it can be completely normal. Understanding the different types of bleeding and their causes can help alleviate some of the worry. Up to 25% of women experience some bleeding during the first trimester. This statistic might seem high, but it highlights just how common this issue is. Knowing that you're not alone can be reassuring. Most of the time, it's completely normal and nothing to worry about. Early pregnancy bleeding can be due to a variety of benign reasons. Let's explore some of these causes in more detail. For instance, implantation bleeding can occur when the fertilized egg attaches to the uterus. This usually happens around the time your period would have been due, so it can be confusing. Implantation bleeding is typically light and short-lived. It's usually light and brief. You might notice a few spots of blood or light bleeding that lasts for a day or two. This is generally not a cause for concern, but it's important to know when to call your doctor. While light bleeding can be normal, there are times when you should seek medical advice. Knowing the difference can help you take the right steps for your health and your baby's health. Heavy bleeding, strong cramps, or passing tissue could signal a miscarriage. These symptoms are more serious and require immediate medical attention. If you experience any of these, contact your healthcare provider right away. Ectopic pregnancies and molar pregnancies are rare but serious causes of bleeding too. An ectopic pregnancy occurs when the fertilized egg implants outside the uterus, often in a fallopian tube. This can be life-threatening if not treated promptly. In the second and third trimesters, bleeding is less common and more concerning. Bleeding later in pregnancy can be a sign of more serious conditions that need immediate medical attention. Conditions like placenta previa or placental abruption require immediate medical attention. Placenta previa occurs when the placenta covers the cervix, while placental abruption is when the placenta detaches from the uterine wall. Both conditions can cause significant bleeding and pose risks to both mother and baby. So, what should you do if you notice bleeding? The first step is to stay calm. Panicking can make the situation feel worse. Take a moment to assess the situation and gather information. Keep track of the amount and type of bleeding, and call your doctor. Note the color, consistency, and any accompanying symptoms like pain or cramping. This information can help your healthcare provider determine the cause and the best course of action. Remember, light spotting is often normal, but heavy bleeding needs immediate attention. If you're ever in doubt, it's always better to err on the side of caution and seek medical advice. Bleeding during pregnancy can be worrying, but it doesn't always mean there's something wrong. Many women go on to have healthy pregnancies and babies despite experiencing some bleeding. Stay calm, stay informed, and always consult your doctor if you're unsure. Your healthcare provider is there to support you and provide the best care for you and your baby. Your health and your baby's well-being are the top priorities. Taking care of yourself, staying informed, and seeking medical advice when needed can help ensure a healthy pregnancy. Educating yourself about pregnancy can also help reduce anxiety. There are many resources available, from books to online articles, that can provide valuable information about what to expect during pregnancy. Attending prenatal classes can also be beneficial. These classes can provide you with practical knowledge and skills, as well as a sense of community with other expectant parents. Practicing relaxation techniques can help manage stress. Techniques such as deep breathing, meditation, and prenatal yoga can be very effective in keeping you calm and centered. Talking to a support group can also be helpful. Sharing your experiences and hearing from others who are going through the same thing can provide comfort and reassurance. Having a supportive partner or friend can make a big difference. Don't hesitate to lean on your loved ones for support and encouragement. Maintaining a healthy diet is crucial during pregnancy. Eating a balanced diet rich in vitamins and minerals supports your health and your baby's development. Taking prenatal vitamins can also help ensure you're getting the necessary nutrients. Your healthcare provider can recommend the best vitamins for you. Staying hydrated is equally important. Drinking plenty of water helps maintain your body's functions and supports your baby's growth. Regular exercise can benefit both you and your baby. Activities like walking, swimming, and prenatal yoga can help keep you fit and prepare your body for labor. Getting enough rest is essential. Pregnancy can be tiring, and your body needs extra rest to support the growing baby. Avoiding stress is also important. Try to minimize stressful situations and focus on activities that bring you joy and relaxation. Maintaining a positive mindset can make a big difference. Surround yourself with positive influences and focus on the joy and excitement of bringing a new life into the world. Preparing for your baby's arrival can also help reduce anxiety. Setting up the nursery, buying baby clothes, and planning for the birth can make you feel more in control and ready for the big day. Creating a birth plan can help you feel more prepared. Discuss your preferences with your healthcare provider and make a plan that aligns with your wishes and needs. Packing a hospital bag in advance can also help. Include essentials like clothes, toiletries, and items for the baby, so you're ready to go when the time comes. Having a list of emergency contacts is important. Make sure you have the phone numbers of your healthcare provider, hospital, and a few trusted friends or family members. If you have other children, make a plan for their care during your hospital stay. Arrange for a trusted friend or family member to look after them. Don't forget about your pets. Make arrangements for their care as well, so you can focus on your new baby without worrying about your furry friends. Planning for postpartum support is also crucial. Arrange for help with household chores, meals, and other tasks, so you can focus on recovering and bonding with your baby. If you plan to breastfeed, consider arranging for breastfeeding support. Lactation consultants can provide valuable guidance and help you navigate any challenges. Mental health support is equally important. Pregnancy and the postpartum period can be emotionally challenging, so don't hesitate to seek help if you need it. Make self-care a priority. Taking time for yourself, even if it's just a few minutes a day, can help you stay balanced and healthy. Plan for family bonding time. Involving your partner and other children in the pregnancy and preparation can help strengthen your family bonds. Think about your baby's first days. Plan for how you'll handle visitors, feeding, and sleep schedules to make the transition smoother. Schedule your baby's first checkup. Make sure you have an appointment with your pediatrician shortly after birth to ensure your baby is healthy and thriving. Plan for your baby's vaccinations. Discuss the vaccination schedule with your pediatrician and make sure you're informed about the necessary immunizations. Look forward to your baby's milestones. From the first smile to the first steps, these moments are precious and worth planning for. Think about your baby's education. While it may seem far off, it's never too early to start thinking about your child's future and the opportunities you want to provide. Plan for your baby's safety. Baby-proof your home and make sure you have all the necessary safety equipment, like car seats and baby monitors. Focus on your baby's health. Regular checkups, a healthy diet, and plenty of love and attention will help your baby thrive. Most importantly, plan for your baby's happiness. A loving, supportive environment is the best gift you can give your child. Plan for your family's future. Think about your goals and dreams and how you can achieve them together. A happy, healthy pregnancy is the foundation for a happy, healthy family. Take care of yourself, stay informed, and enjoy this special time in your life.